Franklin.
Here.
Lauer. Here. Galvin.
Here.
Tallwater.
Here.
9 present.
Okay, quorum being present, we'll stand for the Pledge of Allegiance. Crystal, if you want to lead us.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Move to approve the previous journal.
Second.
We have a motion and a second. All those in favor, sign of aye.
Aye.
Aye. Those opposed, it's approved. Under hearings, today we're going to have a public hearing about the mask mandate, whether to extend the mandate or not. And we do have a list compiled. Thank you, everybody, for taking your time and coming in and making your voices heard. We will be calling those here in a minute. I do ask, there's a couple of things, while we're in this building, unless we have the plexiglass around us, we're to wear the mask. Number two, if someone has already gone over the points that you've been talking about, there's no need to repeat each other. So if we can kind of keep that in mind. We'll give everyone 2 minutes to speak, and we are going to hear from the health department and from Truman Medical Center. They're gonna go first, and then Mary Jo, if you would start calling up some of the names. We have people from all over, and also remember, Kansas City has their own mask mandate, and Independence also controls theirs because they both have a health department. So our vote will not change what is done in those areas. So let's go ahead and hear from Frank. Is it Bridget, or maybe I'll let you introduce the people?
Should be Bridget. Bridget and Ray will go first, and Dr. Steele will be the last presenter.
Okay.
Right. Good morning, Chairman and members of the legislature. Can you guys hear me okay?
Yes.
Okay, great. My name is Bridget Schaefer. I'm the Jackson County Health Department, and I do have with me Ray DeLugalecki with the Health Department and Dr. Steele from Truman Medical Center's University Health. I do understand that we have a shorter time frame for this presentation, so I will just jump right into those current trends that are available. Please note that all of these data points were put together last week to prepare for this presentation. Ray, if you want to advance the slides. Go ahead. Okay, so this CDC slide on the right side of the screen, if you're viewing the presentation in real time, which you are, you can observe a 30-day reflection of the change in levels of transmission across the Midwest. So this is from 7/22 to 8/22, I believe, and Missouri is reflected in the near center of that animation. Levels of transmission are determined by the Centers for Disease Control and Prevention and look at both the new cases per 100,000 and the percent positivity over the last 7 days. As you can see, all Missouri counties are currently in the high transmission level, as well as those counties that are around us here in the metro area. So Jackson County, Eastern Jackson County specifically, we have 309 new cases per 100,000 in the past 7 days, and we're at a 14.3% positivity over the last 7 days. This map here is from the state of Missouri's dashboard, and the map on the left represents cases by jurisdiction to date. So at this time in Jackson County, we sit second in the state of Missouri at 14,935 infections per 100,000 throughout the course of this pandemic. On the right of the screen, it represents a more recent analysis of our trends, so in the past 7 days by jurisdiction. And when this data was pulled on August 25th, we were 9th out of the 117 different jurisdictions represented on this website. The last time we presented, we were 356 cases per 100,000, and we're right around there at 354 cases per 100,000 today, or at this time on the 25th. This slide here is showing our cases over time again. Since the week of 8/1, we have seen a downward trend in daily average new cases and the 7-day case rate per 100,000. When creating this slide, we were still receiving case reports for the week of 8/15, so this data is subject to change. We're currently cautiously optimistic that we will continue to see a decline, but although this data is showing that slight decline, we're still, again, 3 times higher than the threshold for high levels of community transmission as outlined by the CDC. Again, that 309 cases per 100,000 would be 3 times higher than that 100 that we classify as a high level of transmission. As far as percent positivity, same kind of trend here. Since 8/1, we have seen a slight downward trend in percent positivity. When creating the slide, our percent positivity was at 14.3% for the week of 8/15. While this is, again, a slight decrease, this is higher than that threshold of 10% for high levels of community transmission as outlined by the CDC. This slide here shows cumulative case rate per 1,000 over time. That 20 to 24 and 35 to 44 have had the sharpest increase as of late, and you can see that 35 to 44 is almost eclipsing the 85 and older, and most likely will here soon. When looking at the data for just August, so you can see the case rates by age group. We have the highest case rate in the 20 to 24-year-old, then 35 to 44, and then 25 to 34. That 15 to 19 is just slightly behind that, and you can see even the 10 to 14 is now a higher case rate in the month of August than any of those over 65. As far as vaccinations, at this point, approximately 49% of our total population has initiated vaccination, and 43% have completed the series. The largest uptick in age groups initiating vaccination are those 10 to 24-year-olds, as highlighted in that green area. And we hope to continue to see increases in vaccination. As we know, our vaccination rates are still inadequate, and that is going to be the best prevention for COVID-19 and severe hospitalizations and deaths in the future. So. This slide here is showing breakthrough case rates, or the differences between the breakthrough case rates and those that are not fully vaccinated. So the green bar graph is showing the percent of our population that is vaccinated, the total percent. The yellow line is showing the case rate per 100,000 by those that are unvaccinated or not fully vaccinated. And the black line is showing the case rate per 100,000 by those that are fully vaccinated, which is also known as our breakthrough case rate. So the case rate in the unvaccinated, or those that are not fully vaccinated, is about 5 times higher than that of the vaccinated or the breakthrough case rates. Quickly go through this one. This is just talking about transmission in kids. So we know children can get COVID. We know that high levels of community transmission in the community increase the likelihood of outbreaks in the school setting. And we also know that masks work in stopping transmission in the schools. And here's just showing some of those case rates per 1,000 over time by age groups of school-age kids. So in July, we were seeing some really high case rates among school-age children. Since 8/1, again, we have seen those trends decline, and now we're hopeful that with masks in school, we can continue to see a decline and keep those kids from transmitting COVID-19 within the school setting. As far as the healthcare system, the image on the right is showing new hospitalizations in the MARC region. We have seen a slight decline from 144 daily new hospitalizations on 8/6 to 141 on 8/25. So again, that's a very slight decline there. On 8/18, regional hospitals exceeded their record ICU peak capacity that was experienced in November of 2020. And many hospitals are still reporting high volume, and those that are coming in that need to be hospitalized for COVID are not fully vaccinated. This is just a quote that was in an article last week. This is from a St. Luke's physician, and I'll just read it here. Kansas City is in a state of crisis. We at the bedside of patients, whether they're suffering from coronavirus or any other injury or illness, are quite literally running from one fire to the next. What's different now is that, again, we are seeing younger patients, sicker patients, and patients who were baseline healthy before getting coronavirus. And then before I turn it over to Dr. Steele, I'll just quickly talk about the EMS system. So EMS crews are required to wait a longer time right now to transfer patients to the care of emergency departments due to high volume at the hospital levels. So they're required to transport patients further away than necessarily what they would normally do in their agency's coverage area. And of course, that can lead to issues with patient outcomes as some diagnoses might be time critical. We did get a strike team of 11 ambulances from FEMA that have been deployed to our region, and that was deployed on August 7th. And at that, as of August 25th, over 200 patients have been transported by these strike teams, with the furthest going to Oklahoma. So we are seeing a real strain on EMS and transferring. So again, I'll turn it over to Dr. Steele to add anything from the hospital perspective and Truman Medical Centers.
Yeah, good morning, everyone, and thank you, Bridget. First, I'd like to thank the county executive and the legislature for the $27 million and support to help us with our COVID preparation. And I could tell you, little did we know how critical this would be with this Delta variant surge that we're currently experiencing. The EICU that we stood up out at Lakewood and the additional beds we added there were totally full at the end of last week. The PAPRs, which are the powered air purifying respirators, and the additional negative pressure isolation rooms we were able to create have helped to keep our staff safe while caring for the significant surge in COVID patients that we're currently experiencing. Also, the additional high-flow nasal cannulas that we received have been critical, and even with the additional ones, I was worried at one point that we would potentially run out of those because of the number of patients that we're receiving. The additional ventilators have also been very important, so I want to thank you all very much for that support. As to where we currently stand, we currently have 61 COVID patients admitted at Truman University Health between our two campuses. And we were at a high of 64 3 weeks ago. And that's the highest that we've had since the pandemic started. So we had 62 back in January. So we're right back up where we were during the winter months. Only 2 of the patients currently admitted as of Friday were not fully vaccinated. So this is clearly the patients that we're seeing and are requiring hospitalization are those who are not fully vaccinated. We currently have 20 patients in our ICUs and 4 currently on ventilators. We're running very full. We're currently holding 13 admitted patients on our Health Sciences District ED because we don't have an open bed currently to place them in. On Friday and Saturday, we actually had no open ICU beds. But then we had 4 COVID deaths over the weekend that ended up resulting in some of those beds becoming open. Our acuity that we're seeing is very high. The patients are very sick. And there's currently data now out of Great Britain that suggests that you are twice as likely to end up in the hospital when infected with the Delta variant than you were with the original strain of the virus. And once again, this is predominantly in unvaccinated individuals. We have already experienced 22 COVID-related deaths in August. 2 of these patients were in their 30s, 4 in their 40s, and our high prior to this month was 15 in January. So this is a very serious outbreak that we're experiencing. It's putting a lot of pressure on our beds and actually all the hospitals here locally. And as we sit here today, 5 of the hospitals in the metro are on high volume this morning because of how busy they are. Also, staffing our available beds continues to be a considerable challenge, not only for us, but for the other hospitals across the metro. So that pretty much concludes what I had to say.
Okay, thank you.
Good morning. Thank you for the opportunity to present today. I'm going to speak a little bit about how we mitigate this current trend that we're experiencing. The situation necessitates
And if we could have you identify yourself and where you're from.
I apologize about that. This is Ray DeLugalecki. I'm with the Jackson County Health Department.
Okay.
Okay, so I'm going to speak a little bit about mitigating this current trend that we're experiencing. Thankfully, we have a wealth of data and evidence to suggest possible interventions that may affect the current trend. The first thing that I'm going to talk about is masking. We have a strong body of evidence that supports universal masking as an effective strategy to interrupt transmission, especially if we're combining it with other mitigation measures like vaccinations, hygiene, distancing, and other components. We know that masking works primarily through source control, so we're reducing the emission of virus-laden droplets from those individuals who are infectious. Although dependent on the mask or type of mask that you're wearing, there may be some additional secondary protection limiting the inhalation of those droplets by the wearer. Very briefly, in addition to understanding the mechanism by which masks work, we also have data and evidence to suggest that mask requirements have a positive impact on reducing transmission overall and community levels. So briefly, the graph on the screen comes from an MMWR, which is the Morbidity and Mortality Weekly Report from the Centers for Disease Control. This is examining the difference between counties that required masking and those that did not in the state of Kansas. The dotted line in the middle is a mask or an executive order requiring masks that went into effect, and counties in the state of Kansas had the ability to choose whether they implemented that or not. On the left of the dotted line, you'll see 2 different color circles, which represent unmasked and masked counties before the mandates went into effect. After the implementation of the mandate, masked counties saw a noticeable decline in overall case rate, which is represented on the top of the screen with the green arrow, and you can see that decline in case rate overall, whereas those unmasked counties saw a continued increase in case rate over time. This was actually further reinforced by a different study from the JAMA network, which also looked at the mask order in the state of Kansas. The increasing trend in incidence reversed completely, which is represented by that green line or green arrow in the middle of your screen. Case rates were 2.1 times higher in no mask counties than those with mask requirements. Hospitalizations were 1.8 times higher in no mask counties than those with mask requirements. And deaths were 1.8 times higher in no mask counties than those with mask requirements. In short, masking is but a single strategy that has been shown to interrupt transmission. And as I mentioned before, it works best when we complement it with high vaccination rates, adequate testing, contact tracing, and appropriate isolation and quarantine. Individual behaviors like limiting exposure pathways in high-risk settings, hand washing, social distancing, and others have also been shown to be effective. While vaccination remains our most effective intervention overall, we still need to maintain the ability to be adaptive enough to respond to the needs of the situation, which necessitates action. I'm going to turn it back over to Bridget to briefly talk through our recommendations as a health department.
So moving forward, the health department would strongly support the extension of an order requiring masks as we presented that data and report to you all last week. That would be for all indoor places regardless of vaccination status.
All right, thank you all for the update, and we appreciate that. And I think we'll go into the public hearing part of this. As I said before, you'll be allowed 2 minutes to give your information. And if it's already been said, please kind of limit that. Let's try to have new things. Mary Jo, I'm going to just ask that you call names off of the list. It looks like we have about 18 people. So let's pick them in whatever order you want.
Kim Horstman from Blue Springs.
Yes, please come up. That's the other thing. And the microphone is right there. Please pull that close to you so that everybody can hear.
May I take off my mask to speak?
No.
No? Okay. Now I know the challenges teachers have. I'm speaking on behalf of hundreds of individuals, and I'm here to tell you collectively what we know. We know that this mask mandate is invalid and is an overreach of your power per Section 536 of the Statutory Actions and Torts for Missouri. We know that there is widespread defiance of your mask mandate. Businesses do not have the resources to enforce the mandate, and to ask them to do that puts them in harm's way. We know that we and others do business in places in other counties where there is no mandate. It's worth the drive. We know that everyone has a choice on how to protect themselves. Some will choose to get a vaccine. Some who have been infected will rely on their antibodies that they built. Some will exercise more to build immunity. Some will wash their hands more. Some will wear a mask. And some will choose to do nothing at all and roll the dice. As with all other decisions in life as an American, this is their choice. We know that the health department has made it a goal to increase vaccinations, and yet we know of at least one person, all of us, that has decided not to get the vaccine now because there is no longer a benefit to them if they have to wear the mask, even if vaccinated. And as the doctor from Truman alluded to, it is predominantly unvaccinated individuals that are driving this trend. We know that cloth face masks are not governed by any standards and that their filtration performance is unknown. We know that for every study that will conclude that cloth masks work, there is another study that says that they don't work. And for the studies that do work, that says that they do, they have not isolated the masks as the winning factor as far as preventing the viruses. Other factors that went along with that were not considered. We know that in our own county that the prior mask mandate imposed July 1st, 2020 did nothing to reduce the spread of the virus, and we know this because of the data that's on the dashboard. On July 2nd, 2020, there were 37 cases reported. This continued to rise 4 months later with 251 cases reported on November 2nd. And that was when people cared and were wearing them properly. Numbers did not decrease significantly until May, after the mutation of that virus had run its course. That's how airborne pathogens work. We know that asking children to wear a mask all day at school is ridiculous. We know this because even with the Delta variant, the combined caseload per 1,000 ages 0 to 14 is 167, with the majority of those being in the 10 to 14 range, most of which now have access. Can you give me just a moment to finish, please? Just a moment, please. I've only got 3 left. We know that we don't trust the CDC's advice, and we know that we don't trust the local health department either. There was a Harvard poll that stated that in May. And if you rely on them to make your decisions, we don't trust you either. We know that you are not responsible, nor were you elected to make decisions about our personal health. And lastly, we know that the state of emergency that was ended on Friday by Governor Parsons, that you have to hold this hearing now every 21 days to extend the mandate. And all of us will be here every 21 days and in greater numbers. Thank you.
Jill Sass.
Yeah, she had 2 minutes and 48 seconds, so we should get that.
Jill Sass.
Good morning, I'm Jill Sassy. I do share I come from a different perspective, and my comments are predominantly directed toward our mayor, because he's the one that I hear talking about this most of the time. I want to talk about our founding fathers and how they viewed how they viewed the world through a biblical lens. Our Declaration of Independence and our Constitution were written from that perspective. We talk a lot about justice, and God tells us what justice is and what it is not. For example, God says, "You shall not pervert justice. You shall not show partiality, and you shall not accept a bribe. Justice and only justice you shall follow. You shall not pervert justice." Mr. Mayor, you have told us we must mask up to keep us safe. The science does not back that up. In fact, the masks are causing social, emotional, and educational scars that will be with us for years to come. This mandate is a perversion of justice. You shall not show partiality. Mr. Mayor, many of those coming across our border illegally are spreading COVID across the nation, including our city. We are told we have to wear masks to protect ourselves and our neighbors. You are giving preference to lawbreakers while imposing an unjust edict upon the citizens of Kansas City. I do have personal experience with that. I will not go into that now. You shall not accept a bribe. Mr. Mayor, I'm not suggesting that you would accept money or gifts in return for our loss of liberty, but it is common among politicians to seek favor from those who can elevate their reputations or further their careers, and that includes those in Washington, D.C., that we might seek favor from. Our 14th Amendment guarantees us...
You're now into bonus time.
Excuse me, I'm almost finished. The mask slows me down. Our 14th Amendment guarantees us equal protection under the law. This mandate is a deprivation of our liberty without due process. We are a free people. We are law-abiding citizens. You cannot take our liberty from us because it doesn't belong to you. It is given to us by God. Thank you for your time. And my husband timed me at 1:45, by the way.
Thank you.
Without a minute.
What?
Nick,
Next
Nick Blease from Lee Summit.
Morning.
Good morning. So I'm proud to be here this morning to advocate on behalf of the most important members of our community, our children. I'd encourage you to filter out the misinformation that's floating around and instead heed the advice of our medical professionals, our doctors, who are begging us to listen to the facts. Those facts are the Delta variant is affecting our children, and masks work. Now, multiple school districts across our county have made the message clear to parents. No county mask mandate, no masks required in our schools. We can't put our kids in that situation, many of which aren't yet eligible for the vaccine. Now, on that note, I'd also encourage you to heed the guidance of the American Academy of Pediatrics and the CDC and amend the mandate to include those ages 2 through 5, because our pre-K kids need help as well. Simply put, you must act to protect those who can't protect themselves. Now, your vote is your voice, and I challenge each of you today to voice your support for the children of Jackson County. Give our kids a fighting chance, keep our kids in school, and vote to extend the mandate. Thank you.
Thank you.
Rachel Hilton from Lee Summit.
Hello,
morning.
can you hear me? Okay, I'll lean nice and close. My name is Rachel Hilton. I came on behalf of my businesses, as well as the co-founder of the Missouri Business Coalition. I, in good faith, cannot enforce my members to work out in masks. for multiple reasons. I've reviewed several studies that show the reduction not only in comfort, but in cardiovascular ability while doing exercise. And those studies were done in healthy individuals ranging from age 25 to 35 years of age. My members, 60% of them are over the age of 40. Not to say that they're old by any means, but the studies were done on what they called young, healthy individuals. People come in my doors to become healthy, to better themselves. And I will not enforce something that could potentially harm them or deter them from doing that, in fact, thing. Thank you for your time.
Thank you. Next.
Christine Jones, Lee Summit.
Okay, I'm starting my timer now. Okay, so.
And if you pull the microphone close. Thank
Okay.
you.
So in reading through the documentation that was filed, you are basing the extension request on 3 different points. Number 1, the high prevalence of COVID in our region. Number 2, a relatively low vaccination rate in our area. And number 3, scientific evidence supporting the benefits of universal masking. So to the first point, Governor Parson terminated the executive order 2107 that this original mask mandate was based on this last week. He replaced it with 2109, which says that he declares a state of emergency only relative to staff shortages in the state's healthcare system, not to a rising COVID rate. So the real crisis is healthcare staff. So that's your first point. It's not about a rising COVID rate. Number 2, relatively low vaccination rates. As of 3 a.m. this morning, I wanted to be real current on this. As of 3 a.m. this morning, the CDC stated that Jackson County currently has a 52% vaccination rate. Okay.
You're into bonus time.
No, I'm not, because I gave myself about 30 seconds extra. I set my timer to 1:30. So the CDC says that 52% is vaccinated in Jackson County. So that strikes down your second point. Your third point is that there's a mitigating factor to masking. There is not. Did you know that the World Health Organization says that cloth masks are not advisable under any circumstances? So you have that. In addition to that, people that are not in a medical setting using masks, actually, there's an improper use of masks may increase transmission associated with incorrect use and disposal of masks. So I am challenging the statistics that were given. They were picked, they were chosen. The CDC website does not match the data.
Thank you. We
Yes.
appreciate it, and thank you for your testimony.
Mr. Chairman,
Yes.
if we're going to have a time limitation, can we enforce a time limitation?
It was 2 minutes and 48 seconds, just like the first one, since I didn't do
Well,
the
but we were
first one.
supposed to be at 2 minutes. If you have bonus times, if everybody keeps going over, then it keeps getting longer.
It
and
is,
longer.
I'm going to warn them at 2, and then it'll be 2:48.
Okay,
will be
thank
the-
you,
will be
just
the-
as long as we stay consistent.
Yep.
Timothy Sullivan, Buckner, Missouri.
My name is Tim Sullivan, Buckner, Missouri. I have 4 daughters in the Fort Osage School District, and my wife teaches there. Under the county executive's order, all 5 are mandated to wear masks at school. Today I ask, using sound, appropriate, common sense science, what are we doing? We trust our elected officials to ask quality questions and seek and demand solid answers. So I ask again, what are we doing and who are we listening to? All masks under the confusing broad definition of a covering in the order have 0% efficacy, yes, 0% against this aerosol virus. And there is a difference between a droplet and an aerosol. This is not my data, but data from the occupational and environmental toxicology experts like Dr. Stephen Petty of Florida, who are leading industrial hygienists concerning microbe spread, but more importantly, suggesting environmental engineering controls. These are the people we should be listening to. We know the virus spread is most effective as an aerosol in size 0.3 to 5 microns. Your mask, everyone's masks in this room, are not tight-fitting. These masks will not and do not stop the aerosol virus. If we were putting people in tight-fitting respiratory protection placed on the mouth, nose upon leaving house and left untouched all day, this would at least be a start. Better yet, why aren't we asking human physiology questions? What is the man's genetic God-given potential to defend himself against a microbe? Allowing behaviors to smoke, consume sugar unchecked, little exercise, and other lousy lifestyle behaviors while encourage him to toxify blood via drugs and biologics, yet allowing him to think that a cotton mask worn loosely throughout his day, but are willing to fine him at the county level if he doesn't wear it indoors in Blue Springs and Green Valley, not Independence. Where is the sound science in that? This mask order and masks themselves give a false hope. If you want to mandate something to help defend residents from this infection, can I suggest an order to suspend the sale of tobacco products in the county? What we do know is that wearing a mask for even a short period of time decreases oxygen by up to 20%. And wearing a mask all day traps moisture where other pathology can grow. My daughter's 6 years old. At the end of the day, we should see her mask.
And you're into bonus time.
Oxygen is vital for tissue and cell repair and immune defense. Knowing this, placing a child in a mask 7 hours a day, 5 days a week is child abuse. Please listen. Do not let this mask order continue. Thank you.
Thank you.
Bethel Hall, Kansas City, Missouri.
And remember that we do not have jurisdiction over Kansas City because of their health department, but you're allowed to testify.
Yes, many of my friends live in the county. My name is Bethel Hill. I'm a registered nurse. I'm also 74 years old, and I have had COVID. And I've watched my friends' children who have had to wear masks to school all day end up in the emergency room with asthma attacks. And the doctor's notes are taken to the schools. I could tell you which school in particular, but that doesn't matter right now because of the mask mandate. The school is disregarding the doctor's note that says the child doesn't have to wear a mask because he has asthma. And so that's anecdotal. That's all I want to say. I'll give back the rest of my time to anyone else who's speaking against the mask.
Thank you.
Christy Johnson, Nick, Green Valley.
Nick is my son, and he's going to help me here. I emailed this to all of you all yesterday. It's a photo of the coronavirus compared to a strand of human hair. The coronavirus is about 40,000 times smaller than the single strand of human hair. So we wear these cloth masks that are ill-fitting, they're loose, and so do you think that you could get a human hair in those gaps? What about 40,000 times smaller than that? Definitely could get the mask. There's a study that can be found from the National Center of Biotechnology's website saying that the cloth masks are not effective due to several factors. Poor efficiency due to the presence of larger pore size in the fabric. The study also demonstrated that washing and drying cycles, which I think we're supposed to wash and dry these regularly, that stretches the material, filtering the efficiency and making the pore shape and clearance improper. The study also found that stretching of the cloth mask to put it on your face alters the surface of the pore size and decreases the filtering efficiency. The findings of the study ultimately say the cloth masks are not effective. For many, the CDC's website seems to be the go-to place for guidance, and I'd also like to point out here that the CDC is not the fourth branch of government, and we did not elect the CDC. With that being said, even the CDC says that surgical masks provide the wearer with not a reliable level of protection. You can find this on their website. Rather than basing a decision on what is hoped will work, the decision should be made on what's scientifically shown to work. If we follow the science, it's easy to understand and see that the coronavirus is microscopic. It's going to get through a cloth mask. Thank you for your time. Nicholas would like to say something.
Thank you.
I don't like masks. They give me a headache.
Thank you.
Ashley Alshawish from Lee Summit.
Good morning.
Good morning. The problem with mask mandates is that there have not been enough conducted studies regarding the general public wearing masks of various materials in various unsanitary conditions to determine if COVID-19 particles can travel on respiratory droplets. The only evidence that we do have is the difference in COVID cases pre-mask mandate, during a mask mandate, and post-mask mandate. The evidence on your own dashboard shows that there was no difference between those three periods. In fact, during February of 2021, the European CDC published that there was no scientific evidence of masks providing efficacy in preventing the spread of the coronavirus. The National Institute of Medicine has published several studies with the following conclusions. 1, exercising or even brisk walking while wearing a face mask drastically increases the risk for an individual. All the while, our public schools are actually masking our children during PE times and at recess. It has already been proven that COVID lives indoors and is eradicated by sunlight, and this is completely unnecessary child abuse. 2, oxygen flow is greatly reduced while wearing an N95. 3, particles from various viruses, including COVID, have been found living on the outside of contaminated masks. Subjects were actually self-contaminating themselves while wearing their mask. The New England Journal of Medicine published an article last year concluding that the need for universal masking, even in hospital environments, was due to a result of only increased anxiety and fear from the pandemic, and there was no scientific evidence or reasoning to actually back this. Many studies have numerous accredited scientific organizations have concluded that N95 masks had no effect in the prevention of influenza, SARS, and like viruses. Next, I would like to address cloth masks, which many people in our community wear. The U.S. National Library of Medicine has proven that the infection of influenza, SARS, and like viruses was highest among subjects wearing cloth masks, even higher than those wearing no mask at all in the exact same environments. Last year, the Center for Infectious Disease noted that several points that the CDC actually failed to reference.
We're into bonus time, just so you know.
Thank you. While citing that cloth masks were both ineffective and dangerous. Further, the moisture that's actually built up on these cloth masks can actually carry SARS and COVID. Please, for the sake of us all, stop these ridiculous mask mandates now.
Thank you.
Mark Jones, Kansas City, Missouri.
Good morning, and thank you for the opportunity. I have questions. Why is it that our health department does not support any kind of prophylactic? We have India as an example and Japan as an example. They're prescribing ivermectin. Some doctors are prescribing hydrochloroquine. These are been proven in other countries to work, but you can't get our health department to acknowledge anything about that. That's because it's a global agenda. Are you looking at the bigger picture of what is happening to our globe? It's not just the United States, but it's all over the world that they have this intentional lockdown. It's basically following Operation Lockstep. And if you're not familiar with Operation Lockstep, you should be, because it tells you exactly what's happening to our world today. So I think it's really important that we step back and look at the bigger picture at what's happening and the loss of liberty, because that's exactly what's going on. We're losing freedom, we're losing our liberty, and honestly, if you vote for this mask mandate extension, it's just one more nail in the coffin, and it's going to be on you. And we really want to come after you and remove you from office, because this is wrong. You can't continue to do this stuff without having repercussions. You are elected officials, and these people who from the health department are not elected. And we're not going to take this forever. You're going to cause a revolution in the country if you don't pay attention to what the people want. And we're asking you to vote against this now that the governor has removed the emergency order. I don't know that you have a choice, but I'm sure you do. They keep voting again and again in different places of the country. We're winning some of these things by showing up. And I appreciate these people showing up.
You're into your 2 minutes.
I'm sure most everyone in this crowd knows that there are doctors who will give them prophylactics and medications to take care of COVID. This isn't about COVID. This is about communism. Thank you.
Donna Gordon, Lee Summit, Missouri.
Morning.
Morning. So my first question is, what is the end game here? What's the goal? Is it 0 cases? Is it some level of vaccination compliance? Is it a blessing from the CDC? If you go to the CDC's website today, there are the following caveats. The CDC themselves have said data regarding real-world effectiveness of community masking are limited to observational and epidemiological studies, as opposed to the higher credibility of a randomized clinical trial. A large-scale CDC study of Georgia school children concluded the lower incidence in schools that required mask use among students was not statistically significant compared with schools where mask use was optional. The CDC's mask guidance on their website notes a list of best practices, but in the real world, we've all seen mask wearers with their masks pulled below the nose, even on the chin, or wearing an ill-fitting mask. A Danish study stated, in this community-based, randomized, controlled trial, we've concluded a recommendation to wear a surgical mask when outside the home, among others, did not reduce SARS-2 COVID infection at conventional levels of statistical significance. The study also noted that even though all of the study participants were fully instructed in the best way to wear a mask, only 46% admitted complying with that. So the human factor overcomes any of the best laid plans. The science has been saying for long before COVID that air quality plays an outsized role in viral spread. A study published in the Journal of Physics of Fluids in July found mask efficacy from 3% to 60%, and that would be for a properly fitted R95 mask. The results suggest that while higher ventilation capacities are required to fully mitigate aerosol buildup, even low air change rates will lead to lower aerosol buildup compared to the best performing masks in an unventilated space.
You're at 2 minutes.
And finally, Shaman in PLOS biology has said the seasonal pattern of respiratory disease can be explained quantitatively on the sole basis of absolute humidity and the direct controlling impact of airborne pathogens. So it's airflow, it's humidity, it's not masks. Viruses spread, COVID will be with us for the foreseeable future, and creating public expectations otherwise, while politically expedient, is deceptive and contrary to actual science.
Thank you.
Terry Streeter, Kansas City, Missouri.
Good morning.
Good morning. I don't have a paper because I know what I want to say. First of all, I've been a nurse for 50 years, and I went through a lot of different pandemics. And I was exposed to a lot of the childhood diseases, and I have a good immune system. Your body builds up its own antibodies. This vaccine, which is really not a tried and true vaccine, the research wasn't done to make it a good vaccine. And when you take this vaccine, it suppresses your antibody system. That's one thing about it. Over 11,000 people that took the vaccine have died. And people that have taken the vaccine have still gotten the virus. And if it was so good, why are they requiring a second dose after 6 months? So that's what I have to say about the vaccine. Regarding the masks, these cloth masks, the blue masks, the virus goes right through them. They subjugate the American people. They subjugate our little kids. They prevent these little kids from getting the oxygen that they need. It also affects them emotionally and psychologically. Many of them are in tears and fighting against it. They're fearful about it, and they shouldn't be wearing masks. And the government shouldn't be telling us that we can't have privileges if we're not vaccinated or if we don't wear a mask. Our constitutional rights have been violated, and they continue to be violated as our government wants to do what they're doing and shut down the American people. And that's what I have to say.
Thank you.
Donna Hainan from Blue Springs.
Good morning.
Good morning. My family of 7 owns Physique Fitness in Blue Springs. I'm the grandma, and I was chosen to speak. Your mandate is wreaking havoc, both financially and emotionally, on our small business. You know, God gives us this body, and He expects us to take care of it. We have the right to choose how we do that. So, do we feed our bodies nutritionally? And do we build our immune system so that if we get the virus, our immune system will fight it and we will come out with a natural immunity at the end of it? Or do we want to live in fear, mask mandates, vaccines, more boosters? Because you know, people, COVID is here and it's probably not going away. It's the flu. Our members, 4:30 a.m., I say, what are you doing here at 4:30 in the morning? We've got to have this workout so that we can better deal with the anxiety and the stress of the day. They eat nutritional meals to build their bodies. Science says exercise benefits body, mind, and soul. And this is not a science that we question. So if you exercise, you eat right, you build that immune system, you're going to be okay and you're going to be a happy person. Mr. White on TV said, we will have mask mandate until the percent of vaccination goes up. Your mandate invites unhappy, confrontational people who are very quick to report to the county
You're at 2 minutes.
non-compliance to their belief. And then your people are at our front counter threatening fine and lockdown. A release, November of 2020, says that your release, that if your activity causes a wet mask, to remove it. If your activity causes breathing difficulty, to remove it. We comply, but if you can go to a restaurant and take your food off, your mask off to eat and drink, you're going to be able to come in and pull your mask down to hydrate and to breathe. And do you guys want to share the liability if someone is hurt because of your mask mandate?
Thank you, ma'am. I appreciate it. we'll have to skip the rest of that, but good testimony.
Okay, let me do my last thing. So
can't-
coming from a grandma,
I know, I
other people have had
understand.
time. So coming from a grandma, you
you've
need to
got
dig
to
deep
stop.
into your heart and your conscience, and you need to get rid of this mandate.
Thank you.
Kelly Sullivan, Buckner, Missouri.
Good morning.
Good morning. Go ahead and start my timer. Hi, my name is Kelly Sullivan. I'm a mother and a teacher. I believe this to be such an important topic that I took a half day off of work. I'm here to speak against the mandation of masks, specifically in our school systems. If you care about children like I hope you actually do, then you would also care to know that there is a growing number of students and teachers who are not doing well with wearing masks. What I'm seeing as a teacher are students who are developing issues such as social anxiety, irrational fears, emotional instability, and depression. My first question would be, what are the long-term effects of wearing these masks? I'm sure you don't know. We don't know. We are in uncharted territory. I'm afraid we will have a number of antisocial, anxiety-driven, emotionally unstable children who don't have the skills to have one-on-one normal conversations, let alone be able to get a job. Which leads me to my second question. How are these students supposed to find success in the real world? While I'm very grateful that students do not have to wear masks while being outdoors, I'm still confused. Why is it okay to not have to wear a mask while in the cafeteria sitting very closely to friends, yet have to wear a mask while in the hallways and classrooms, now distanced from these same exact friends? As a teacher, we have to worry about so many things: kids' safety, building relationships, helping students develop lifelong skills, and so much more. Why is it now my duty to make sure these students wear their masks appropriately? And what is appropriate mask wearing? I know what it is not. It is not taking your mask off, dropping it on the ground, touching it, putting on a table, pulling in and out of purses and bags, and expecting it to work appropriately, which happens every day, and I would say probably is happening in this room. If the science of masks is as sound as you want us to believe, then none of these scenarios actually make sense. By agreeing to mask mandate, you are not creating a positive learning environment for these students. You are creating chaos. I'm sure you have all heard of having 20/20 vision or hindsight, and these are the moments in our life that we wish we could have a do-over. This is that opportunity for you.
You're into the 2 minutes.
Thank you. Before you make a mistake and you wish that you have a do-over, I urge you to make the best decision right now by voting against this mask mandation. If not for you, then do it for the children that you say you care about. Thank you.
Thank you.
Alex Nelson, Lee Summit, Missouri.
Good morning.
Good morning.
Just going to set my timer here. So I want to go in depth a little bit with some of the research that's out there. So just a couple things from the National Institute of Safety and Health Occupation, OSHA, CDC, FDA, all the other lettered organizations. According to OSHA, on the Hospital Respiratory Protection Program Toolkit, these masks, the ones like I'm wearing here, it's meant to stop big air droplets, not fine droplets. And that, again, is according to all of those lettered organizations. Going into the WHO, mask use in the context of COVID-19, on page 3, they're talking about care and usage. When you talk about care and usage of reusable masks, they recommend that the masks get boiled at 140 degrees, okay? According to a national organization I've never heard of before, Consumer Product and Safety Commission suggests that you keep your hot water in your house at about 120 degrees. According to some surveys, people keep their hot water maybe at 130 degrees. So who is washing their masks in 140 degree water? The WHO states that if you do not wash your mask in 140 degree water, if it is a reusable mask, sorry, then you have to boil it for 1 minute. I asked where did they get the 1 minute from, and I asked who's boiling their masks. According to some studies here, the non-usable masks, like we're wearing surgical-based masks, these are saturated within about 20 minutes, maybe even sooner. Going on down the list here, with the latest publication, the WHO stated that masking helped reduce the spread of COVID in older individuals in Japan, grades 9 through 12. The research article that they used to post that had nothing to do with masks. They talked about social distancing. According to the community guidelines on the WHO statement here, a large randomized community-based trial of 4,800 people.
Into the 2 minutes.
Oh, thank you. Healthy subjects. They stated within this trial they found no difference of infection spreading with SARS-CoV-2. Another systemic review, the review concluded that wearing a mask may have little to no difference in prevention of influenza-like illness. Then going down, I want to also state again and emphasize that these masks are not going to stop these small particles. The particle sizes are too small, including N95s. OSHA also states that respirators may not stop these small particle sizes as well.
Thank you.
Thank you.
Heath Westling, Westport.
Good morning.
Good morning. Thank you, folks. This is certainly a passionate issue. I know it can get very volatile. I'm not here to yell or scream. Not here to point out the absurdity that some folks have pointed out when it comes to if we were in a restaurant, we could all be taking these masks off, or the virus particle size, or the fact that we have to wear a mask when we're talking here, but all of our hands are touching this area, which is obviously contaminating everyone who's talking. I actually just want to humanize with you. You're all elected officials. I'm sure you got that way because you're very kind, you're very intelligent. You all have a bed that you need to sleep in at night. You all have a mirror that you need to look in the morning. And you make decisions off of the data that you get for issues that affect Jackson County. And so I know you presented some data here, and I just want to make sure there's other data and perspectives that you're looking at, particularly around cases. You talk about transmissibility in cases a lot in the justification for this mask mandate. And cases are driven by PCR tests that have cycle thresholds that determine the level of amplification that's needed to find these viruses. Dr. Fauci and every virologist knows that anything over 35 is replication incompetent, so it means nothing. It's not a danger to anyone. I'd like to ask the commissioners to find out what our cycle thresholds are set at in the labs here in the Jackson County area that are driving these cases, and to report back to us, the people, to let us know how many of these cases do mean nothing, how many of them are found at cycle thresholds over 35. I'd also like to ask about transmissibility. We all know that viral load increases. Transmissibility increases with viral load. So when it comes to hospitalizations, somebody already mentioned supplements. A lot of prophylactics that can be done to improve people's health.
You're at your 2 minutes.
We the people ask about hospitalizations. There's data that needs to be shown as far as units that have been closed, staffing, nursing shortages, and available beds. Lastly, the collateral damage, suicides, opioid overdoses, psychological mental abuse. We'd like to know those numbers as well, because those are cases and deaths as well as COVID cases and deaths. Thank you all for the time. We the people want that data, and we'd like to provide our consent once we receive that data.
Thank you.
Thank you.
And the last one we have is Liz Megley from 106th and Oak.
Hello, can you hear me okay?
Good morning.
Good morning. I have a very important question for the county legislature. Has an economic impact report been prepared showing how much money the county will lose due to this mandate? If not, I urge you to vote no, at least until this can be done. Many, including myself and many I know, will shop in Cass County, Independence, and even Johnson County, Kansas to avoid the mandates, hurting our small businesses and the county's tax revenue. It is important to note that the last mask mandate in Jackson County was illegal. This commission never voted and let the county executive and one Truman Medical Center employee carry out an illegal mandate for over a year. Where were you during this time? For those who don't know, Truman Medical Center is paid by the county to run our health department. This is a conflict of interest and must end. We don't need one county executive and one TMC employee dictating how we live our lives. If you support the people and businesses of Jackson County, you will vote no to show you stand with us and not with Frake White and a private business. The data does not support community masking. If you pull up the Missouri Department of Health and Senior Services dashboard today, you will see that over 28% of hospital beds are available right here in the Kansas City area. And it's important to note that these are staffed hospital beds. Hospitals like Children's Mercy let go of half of their nursing staff in 2020, and they have not brought them all back. Many nurses are quitting. Truman Medical Center will be even more short-staffed September 19th when their COVID vaccine mandate for staff goes into effect and they lose dozens more healthcare providers who worked tirelessly and selflessly in 2020. This willing loss of nurses has proven Truman Medical Center does not care about their patients and are not fit to run Jackson County's health department. Hospitals are not full with COVID patients. They are lacking appropriate staff to staff their facilities fully.
And you're at your 2 minutes.
Don't let the skewed hospital data scare you into voting yes for this mandate. Lastly, high-risk individuals have 3 options to protect themselves. 1, they can get vaccinated. 2, they can stay home and use carry-out and delivery services. 3, they can choose to wear a mask. Those who are high risk or too afraid to come out will likely stay home with or without a mask mandate. So we ask that you let us live our lives and that those who are afraid can stay home. And for the public and business owners listening, if this passes, I encourage you to not comply. Thank you.
Thank you. Mary Jo, was that the last you said?
That was it.
Okay. Then, just so we can clear some room in here, why don't we go ahead and jump forward on the agenda? And if you would read 20749.
Extending the county's current mask mandate order for the health and safety of its citizens until October 7th, 2021, introduced by Jalen Anderson, Crystal Williams, Tony Miller, and Scott Burnett.
Mr. Chairman.
Yes, Jalen?
Mr. Chairman, I appreciate the discussion that has been said today on this issue. And of course, I know this has been quite a struggle for several folks in trying to make sure, I'll do better, thank you, to really understand and how our lives have been changed, not only as children, but also just as a general of human beings. The passion that's in this room today, I recognize, and I believe my colleagues also recognize, those who have joined me in sponsoring this legislation. But what I believe, and what I have fought for and spoken to and realized, that we face a pandemic that we have not seen in over 100 years. We face something that has crippled the country almost completely last year. The best that we can do is to make sure that our citizens are protected, and we make sure that the vaccinations are still given, that we provide the best health care that we can, but also that we do everything in our power as a government to make sure that we protect everyone no matter the cost. Political focus is not my focus with this. The reason why I introduced this today and proud to stand with the county executive is because having seen friends die last year, I've had over 23 individuals die. 3 cousins who are currently in the hospital today on ventilators. This is not something to be joked with. This is not something to say that it is not real, because it is. We've seen it up close. We understand the struggles that everyone faces. No one up here wants to wear a mask. No one out in the audience wants to wear a mask. I understand this. But the fact of the matter is that sometimes we have to do things that we dislike. I understand about the children. I understand about the struggle that they face and the fears that they face. Having young nephews and nieces, every day they said, when are these going to come off? My God, it's funny to see even a little child come up and try to debate you, and then they finally understand because, and the saddest part is, because their own mother is now in the hospital. Their own mother is on a ventilator. That is why I introduced this legislation. I'm proud to stand with the county executive. Mr. Chairman, I ask that we move to adopt this legislation.
Second.
Okay, we have a motion and a second. Scott, you have a comment?
Yes, thank you, Mr. Chairman. This COVID-19 Delta variant is the biggest, most deadliest killer we faced in 100 years. Now with schools open, the Delta variant is coming for our children. They are defenseless and they rely on us to protect them. When we were children, we were vaccinated against measles, mumps, smallpox, and of course polio, and more. And occasionally I hear that wearing a mask is about our constitutional rights. There's nothing in the Constitution about vaccines or masks or public health ordinances or about seat belts or stop signs. But we have agreed that we will use a seat belt, we will stop at a stoplight or a stop sign. Our hospitals and intensive care units are jammed up. Many people that have heart attacks, strokes, and physical injuries are having trouble getting help. I ask that you think about these things for your family and for your neighbors. Thank you, Mr. Chair.
Okay. Mary Jo, if you call the roll, please.
Anderson?
Yes.
Williams?
Yes.
Miller?
Yes.
Burnett?
Yes.
Finley?
Yes.
Franklin?
Yes.
Lauer?
No.
Galvin?
No.
Tallwater?
No.
6 yes, 3 no.
All right, it will be extended until October 7th.
Mr. Chairman. Sure. Ready to get to our meeting?
All right, we'll be moving on. Communications with and reports of the county executive. Mr. White?
Good morning, Mr. Chair, legislators. I have a couple of presentations I'd like to make real quick.
Sure.
Good morning. I have a couple of presentations I want to make that I think are very special today. Captain Epperson is not here today. He's on vacation, but I want to make sure that we recognize Captain Epperson on his retirement. And this plaque for him is appreciation for 26 years and 1 month of dedicated service to Jackson County, and Friday, September 10th, 2021. So when the captain is back, then we'll make sure he gets these. And also a real special opportunity today also to recognize Captain Dale Covey, who is also retiring. And Captain Covey is retiring after 35 years of dedicated service to Jackson County on September 10, 2021. So I want to say congratulations and thank you for all you do.
The only thing my wife is here. She put in 25 years with the county. I've had 35 years with the county, and we've been honored to serve for you.
Thank you, sir. Thank you very much. And thank you for coming.
Are there any questions for the county executive? All right. Thank you. Perfection of proposed ordinances, there are none. Final passage, there are none. Resolutions in committee 20740.
Ordinate 3-month term and supply contract to the City of Independence, Missouri for the purchase of vehicle fuel for use by the Public Works Department as an acquisition from another governmental entity. Justice and Law Enforcement Committee.
Do I have a report from Justice and Law Committee?
Committee recommends adoption.
Committee recommends adoption unless there's an objection. Hearing none, it will be on the consent agenda for adoption. 20741.
Awarding a 12-month term and supply contract with one 12-month option to extend for the furnishing of fleet fuel cards for use by various county departments to Wex Bank of Midvale, Utah, under the terms and conditions of State of Missouri Contract Number CC 211-293001, an existing government contract. Finance and Audit Committee.
Charlie?
Committee recommends adoption.
Committee recommends adoption unless there is an objection. Hearing none, it will be on the consent agenda for adoption. 20742.
Transferring $44,178 within the 2021 Sheriff's Revolving Fund and awarding a contract for the furnishing of law enforcement video equipment for use by the Sheriff's Office and Parks Plus Rec Department to Motorola Solutions of Chicago, Illinois, under the terms and conditions of Request for Proposals number 19-21 at an actual cost to the county in the amount of $311,751. Budget Committee.
Teresa?
Committee recommends adoption.
Committee recommends adoption unless there's an objection. Hearing none, it will be on the consent agenda for adoption. 20743.
Transferring $30,000 within the 2021 Special Road and Bridge Fund to cover anticipated overtime expenses for the Public Works Department through the end of 2021. Budget Committee.
Teresa?
Committee recommends adoption.
Committee recommends adoption unless I hear an objection. Hearing none, it will be on the consent agenda for adoption. We are at the consent agenda, and I think once we read this, then we're not going to get to watch this movie that we see up on the big screen, which is Tony Miller driving along, playing Thelma and Louise, I think, or something. And but it's been really fun watching the scenery. So we.
I tried to turn my camera off just for your benefit, so you didn't have to look at me. But the county councilor wanted it on. So.
I know. I tried to have it turned off too. Resolutions. Let's see. Perfection proposed ordinance. There were none. Final passage none. Resolutions 20740. 41, 42, and 43. Do I have a motion on the consent agenda?
Move to adopt.
Second.
We have a motion and a second. Mary Jo, if you call the roll, please.
Anderson?
Yes.
Williams?
Yes.
Miller?
Yes.
Oh, thank God.
Burnett?
Yes.
Yes.
Finley?
Yes.
Franklin?
Yes.
Lauer?
Yes.
Galvin?
Yes.
Tarwater?
Yes.
9 yes.
Okay, it's been adopted. Introduction of proposed ordinances and assignment to committee 5538.
Transferring $160,000 within and appropriating $493,081 from the undesignated fund balance of the 2021 Anti-Crime Sales Tax Fund and acceptance of the 2021 Edward Byrne Memorial Justice Assistance Grant awarded to the Multi-Jurisdictional Drug Task Force, introduced by Charlie Franklin.
Charlie, any comment?
Yeah, this is grant money, a lot of it, unless there is an objection, or if somebody wants to send it to committee, we can talk about it. Otherwise, I would move to perfect.
Second.
We have a motion and a second. All those in favor, sign of aye.
Aye.
Those opposed? Charlie?
I would move to adopt.
Second.
We have a motion and a second. Mary Jo, if you call the roll, please.
Anderson?
Yes.
Williams?
Yes.
Miller? Burnett?
Yes.
Finley?
Yes.
Franklin?
Yes.
Lauer?
Yes.
Galvin?
Yes.
Tarwater?
Yes,
8 yes, 1 absent.
he's there.
Oh, sorry.
He's frozen. Tony, we'll let you vote on that one in just a moment when you come back online. 5539.
Appropriating $895,004 from the undesignated fund balance of the 2021 Anti-Crime Sales Tax Fund to provide supplemental funding for combat programs and agencies for use during the remainder of 2021. Introduced by Teresa Cascalvin.
Teresa.
Mr. Chairman, I sent this out to our colleagues yesterday, letting them know that I'd like to pass this today. I haven't received any questions on it. This is new money coming in, so there isn't a need for a public hearing as it's at the undesignated fund balance. We have seriously been working on this for over 2 months, talking about government moving slow. I've worked with the prosecuting attorney, Gene, and with Vince Ortega, and all the I's are dotted, all the T's are crossed, and I'd like to move this today so that we can get the money out on the streets. So I would move to perfect.
Second.
We have a motion and a second. All those in favor, sign of aye.
Aye.
Those opposed?
Aye.
Tony, would you like to vote on 5538?
Yes, please.
Okay,
Change that to 9 yes.
perfect. Thank you. Okay, so we have a motion and a second. Do I have a motion to?
Move to adopt.
We have a motion to adopt and a second by Charlie.
Yes.
If you call the roll, please.
Anderson?
Yes.
Williams?
Yes.
Miller?
Yes.
Burnett?
Yes.
Finley?
Yes.
Franklin?
Yes.
Lauer?
Yes.
Galvin?
Yes.
Tarwater?
Yes.
9 yes.
Thank you. And thank you, Gene and Vince, for all of your work on this. I appreciate it.
Introduction, are there any add-ons?
No, Mr. Chairman.
Okay. Introduction of proposed resolutions and assignment to committee 20744.
Awarding 12-month term and supply contracts with one 12-month option to extend for the maintenance and repair of heavy equipment for use by the Public Works Department to American Equipment of Kansas City, Kansas, Romaine Electric of Kansas City, Missouri, Casey Wholesale of Oak Grove, Missouri, Viking Sides of Grain Valley, Missouri, and Summit Truck of Kansas City, Missouri, under the terms and conditions of invitation to bid number 13-21, introduced by Teresa Cascalvin.
Teresa, any comment?
No comment.
Public Works 20745.
Awarding a 12-month term and supply contract with one 12-month option to extend for the furnishing of crushed rock for use by various county departments to AA Quarry LLC of Pleasant Hill, Missouri, under the terms and conditions of invitation to bid number 45-21, introduced by Teresa Cascalvin.
Teresa.
No comment.
Public Works 20746.
Awarding 12-month term and supply contracts for the furnishing of personal computers and miscellaneous computer hardware and software for use by various county departments to SHI International Corp. of Somerset, New Jersey, Converge One of Overland Park, Kansas, and Delphi Financial of Round Rock, Texas, under the terms and conditions set forth in State of Missouri Contract Number CT 1609-10001, Midwestern Higher Education Commission Contract Number MHEC 07012015, and Cooperating School Districts of Greater Kansas City Contract Number CO 62518, all existing competitively bid government contracts, introduced by Charlie Franklin.
Charlie.
No comment.
Finance and Audit. That might be the last time we read that one. 20747.
Authorizing the county executive to execute a change order to the contract with JCDC Partners LLC of Kansas City, Missouri to allow for the redistribution of existing project funds between existing project components at no additional cost to the county, introduced by Teresa Cascalvin.
Teresa.
So we haven't had a conversation about this. I know that they have been working very hard. Do we need to pass this today?
That would be helpful. That would allow us to keep moving and keep everything on schedule.
Thank you. I'd move to adopt.
Can we have some conversation about it?
Absolutely. Troy, do you have anything you'd like to add?
Yeah, and I can have Mr. Gaddy supplement the information. What this does is reallocates within the JCDC contract money that originally had been primarily source of funds had been benchmarking, where we were going to use dollars to look at other facilities around the country. COVID obviously has precluded those issues. So what this does is move dollars around within the JCDC contract now that we have a site to allow us to move forward on site development, environmental permitting,